Hello medical technologist. Today we will discuss about syphilis. What is syphilis? Syphilis is a systemic sexually transmitted disease caused by the Treponema pallidum bacterium. The three means of syphilis transmissions are person to person via vaginal, anal or oral sex, through direct with syphilis chancres person to person during foreplay even when there is no penetration, pregnant mother with syphilis or fetus. Syphilis, named from poem published by Italian physician and poet Shepherd from his family-law named Syphilis, who angered Apollo and was given to disease as punishment. Treponema pallidum, described in 1905, causes by Treponema pallidum. Transmission: sexual, maternal, fetal, blood transfusion, and rarely to other means of both transmission and getting infected with HIV. Introduction to spirochetes. Longer cylindrical spirochetes are the mobile of spiral viral 4 to 14 length 5 to 20 microns and very thin 0.1 to 0.5 micron, can be seen on fresh primary or secondary lesions by dark field microscope or fluorescent antibody technique. Dark field microscope we will see the spirochete like that. Fluid from chancres. Congenital syphilis usually occur following vertical transmission of Treponema pallidum from the infected mother to fetus in utero, but neonates may also be infected during passage through the infected birth canal at the delivery time. Infection is developed at stages primary, secondary, and tertiary or latent. Morphology have axial filament with otherwise. Treponema pallidum cytoplasm is surrounded by a trilaminar cytoplasmic membrane. Peptidoglycan provide rigidity and it is lipid-rich membrane. 3 or 4 endophalangia originated. Special staining method, Fontana and Leviditti methods. Treponema cannot be cultivated on culture media. They inhibit to grow most pathogenic treponemas in vitro, coupled with the transitory nature of many of lesions, make diagnosis of treponemal infection impossible by route bacterial method. Different stages and signs and symptoms must be included in it. Cultivation of. Although the treponemas are distantly related to gram-negative bacteria, they do not stain by gram method and modified staining procedures used. Moreover, the pathogenic treponemas cannot be cultivated in laboratory media and maintained by subculture in susceptible animals. Resistance. Inactivated in 1 hour at 41 to 42 Celsius. Inactivated when it contact with oxygen, soap, distilled water, arsenic, and mercury, common antiseptic agents. Mode of transmission. Organism is very fragile, destroyed rapidly by heat, cold, and drying. Sexually, transmission most common occur when a broad skin or mucous membrane come in contact with open lesion. Can be transmitted to fetus. Rarely transmission from needle stick and blood transfusion. Pathology. Penetration. Treponema pallidum enter the body via skin and mucous membrane through abrasions during sexual contact. Also transmitted transplacentally. Disseminations travel via the lymphatic system to regional lymph. Invasions of the CNS can occur during any stage of syphilis. Stages of syphilis: primary, secondary, latent, early latent, late latent, late or tertiary, may involve any organ, but may parts are neonate neurosyphilis, cardiovascular syphilis, and late benign gumma syphilis. Stages and pathological changes: primary, chancres; secondary, palmar rashes, lymphoid adenopathy, condyloma latum; tertiary, neurosyphilis, aortitis, rheumatoid, meningiovascular, tabes dorsalis, general paralysis, erythemas, aortic regulations, haplobotom, skin, bone, and others are included in tertiary syphilis. In secondary, condyloma lata are formed. Primary syphilis, the chancre. Incubation period 9 to 19 days. Usually approximately 21 days. Developed at the site of contact, multiplies at the site of inner entry. A small painless primary lesion called chancres is formed. Chancres appears on external genitalia, corner of penis, labia, vaginal wall, also occur in cervix, perineal area, mouth, anal canal that possess hard rigid covered by thick clary exudate rich in spirochetes. Serological tests are positive 80% in individual stages. Secondary syphilis, skin rashes, nucleus patches in ophthalmics, multiplications of spirochetes and their disseminations through the blood, headache, anorexia, malaise, weight loss, nausea and vomiting, sore throat and slight fever, temporary alopecia, nails become brittle and pitted. Latent syphilis. After several weeks, secondary lesions disappear and disease becomes latent, not infected at this stage, except for transmissions from mother to fetus, congenital syphilis. Mother to child transmissions infected in utero may be serious consequence for the fetus. Rarely syphilis have been acquired by transfusions of infected fresh human blood to the mother to baby or baby to mother. Maybe mother to baby. Tertiary syphilis develop after many years in person with untreated secondary syphilis. Appearance of degenerative lesions called gummas in skin, bone, and nervous system. Reductions in the number of spirochetes observed. Affect 2/3 of untreated cases. Gummas, rubbery tumor, bone deformitis, blindness, loss of coordination, paralysis, insanity are included in it. Diagnosis of syphilis, clinical examination of serological test, dark field microscope, special technique used to demonstrate the spirochetes as cinemotile spiral structure with a dark background. The specimen including vagina from the lesions of sometime alien aspirate. It is usually positive in the primary and secondary, most useful in primary stages when serological tests are still negative. In maybe dark field microscope, special technique used to demonstrate the spirochetes as shiny motile and spiral structure with dark background. Diagnosis of syphilis, evaluation based on three factors: clinical finding, demonstration of spirochetes in clinical specimens. More than one test should be performed. No serological test can distinguish between other treponema infections, presence of antibodies in blood or cerebral fluid. Laboratory testing, the direct examination of clinical specimen by dark field microscope or fluorescent antibody testing of sample. Non-specific or non-troponemal serological test to detect a reagent utilized is screening test only. Specific troponemal antibodies tests are used as a confirmatory test for a positive reagent testing. Provisional diagnosis of syphilis. A presumptive diagnosis is possible with sequential serological test, example VDRL, RPR, using the same testing method. Each time confirmatory test should be performed. Provisional diagnosis of syphilis. RPR and VDRL, rapid plasma reagent and venereal disease and research in laboratories. The FATP test, smear of exudate are fixed with acetone. Direct fluorescent antibodies of Treponema pallidum test is performed using fluorescent tagged anti-Treponema pallidum antiserum. Serological test of syphilis depending upon antigen. Serological test, non-treponemal standard test and treponemal test, VDRL non RPR and Weizmann test. FTA, ABs and TPHA are included in it. VDRL. Each preparation of antigen suspensions should first be examined by testing with known positive or negative serum control. The antigen particle appear as a short rod from or magnificent of about 100x aggregation of these particles, large small clumps, reactive on left, non-reactive on right. RPR, rapid plasma reagent, test procedure. Serum or plasma added to circle on card and spread. 1 drop of antigen from the needle capable of delivering 60 drop milliliter is added. Rotate at 100 rpms minute for 8. Results are read microscopically. Daily quality control 20 gauge RPR appear to be more sensitive than the visual. Treponema pallidum hemagglutination test adequate to micro technique. 10-shaped RBCs are coated with palladium antigen from the Nichols chain. Agglutination of the RBCs is positive in the results by using TB-HR test. Positive FDA tests for syphilis view of a fluorescent microscope are seen in the image. Enzyme immunoassay for HIV antibodies, strep 2 and strep 3. Enzyme anti-human globulin anti-HGG is added to the well. The anti-HGG will add the human IgG antibodies bound to the absorbed HIV antigen. All unbound anti-HGG washed from the well. Prophylaxis and treatments are included in it. Every pregnant woman needs to be get screening. Prevention, avoidance of sexual contact with disease, individual use physical barrier and antiseptics, prompt and adequate treatment of all new cases, follow up on source of infections and contact so as to get them cured. Treatment of syphilis. Early syphilis, benzathine, penicillin G 2.4 million units intramuscularly once. Procaine, penicillin 6 lakh units intramuscularly daily for 10 days. If the patient is unable to take penicillin, then give tetracycline or erythromycin 500 mg 4 times a day by mouth, or doxycycline 100 mg multiplied 2 for 15 days. Ceftriaxone 2 gram QD IM IV for 10 to 14 days is a new alternative treatment. Is effective